Okay.
Yeah, we are live now. Okay. So my screen is visible?
Yes.
Okay. So good evening, delegates and participants. Thank you for joining Shield Connect. And today we are with our speaker for the day, Dr. Meenu Vaish. Ma'am is a well-renowned doctor from Dehradun, and she's going to take a topic, do microbes in female genital tract matter in ERD? So before we start with this session, and I will give a little introduction of our page Shield Connect, and then I will give a brief introduction of our speaker for the day. So this is our page shieldconnect.in, where you can find various sections are available. So the first section is the blog section, where you can find all the blogs that are written by our well-renowned doctors who are connected with Shield Connect. And you can also check the webinars. We have conducted around 918 webinars. So you can also check those webinars on past webinars and upcoming webinars calendar. So you can also go through this page, and we have our leader section where you can find all the doctors who are connected with our page. And now let me introduce our speaker for the day, Dr. Meenu Vaish. Ma'am is the director and consultant in Meher Hospital from Dehradun. And ma'am currently is the president of Uttarakhand Society of Obstetrician and Gynecologist, and ma'am was immediate past president, Gynec and Obstetric Society of Dehradun in 2019 to 2021. Ma'am has also received a Medical Excellence Award by Dainik Jagran on Doctor's Day on July 2021. And also ma'am was awarded by Chief Minister of Uttarakhand in 2018, and also been awarded as Best Doctor by Uttaranchal Mahila Association in 2008. Ma'am has also done ART specialist training at Lilavati Hospital, Mumbai, giving her service to infertile couples since 2009. And ma'am is also actively participant in the Green Revolution under public awareness program initiated by Foxy, and has organized many free medical camps in the cities and organized laparoscopic myomectomy workshop in 2019, as well as camps for prevention of breast cancer and cervical cancer under Cancer Protect Foundation. And ma'am is also actively participated in organ donation program initiated by Foxy and cervical cancer screening program under Foxy banner. And ma'am also have also been member of Foxy, PCOS Society, IG, ART, IFS, ISR, Jessicon, and Nachi. And ma'am,
I think it's more than enough.
Yes, ma'am. Okay, ma'am.
Yeah.
So we will hand over the session to ma'am, and we are glad to have ma'am on our platform for today's webinar. Thank you, ma'am.
Thank you for the kind words.
Yeah.
Yes. Today we are gathered here to discuss the do microbes in female genital tract matter in ART. What is microbes? First of all, we need to know microbes and microbiota are the organisms. They are very helpful. They are beneficial to the host. And it has been found that recently it has been found that they have a great influence on fertility. Probiotics are very much used, and they have changed they have improved the fertility parameters of male and female fertility. They have improved. So we will discuss about the microbes, their advantage, how they are helping fertility. The vaginal microbiota plays a pivotal role in the maintenance of the physiological hemostasis of environment and protects the colonization by opportunistic pathogens. A healthy vaginal ecosystem is characterized by predominantly by Lactobacillus species, mainly Lactobacillus crispatus, Lactobacillus iners, Lactobacillus gasseri, and the Lactobacillus jensenii. All these Lactobacilli species are present in the genital tract, and they are helpful for normal health of the female genital tract. In the ecosystem, a hemostatic and the mutualistic relationship exists between the microbiota and its human host. The host provides a humid, nutritious, and a warm habitat for the microbes, whereas the resident microbiota produces microbial and the anti-inflammatory factors. Thus, the first line of defense against the non-indigenous microorganism is established. There is a dynamic equilibrium between the aerobics and anaerobic microorganisms and the probiotics and the microbiota. Vaginal microbiota plays a pivotal role in preventing colonization by microorganisms responsible for genital infections. With the genital infection, many problems arise. Lactobacilli has a definite role, and it has been found with the increased estrogen during the time of puberty and the pregnancy. Their maturation occurs and there is increased glycogen deposition. With the increased glycogen deposition, the glycogen gets converted into maltose under the influence of the alpha amylase. And lactobacillus species provides LDH and it gets converted into the lactic acid and it decreases the pH. With the decrease in the pH, the helpful microbiota is present and it increases the in general health. Lactic acid and lactobacillus species also help in producing the bacteriostrateins. Bacteriostrateins are helpful to prevent the inhibition. They prevent the inhibition of the bacterial growth. Evidence from several studies show a uh, differential vaginal microbiota composition in infertile patients compared with the healthy and the fertile women. An abnormal vaginal microbiota has been associated with a poor reproductive outcome in patients undergoing in vitro fertilization as well as with early spontaneous abortion in patients undergoing in vitro fertilization treatment. What is the effect of the lactobacillus species? The effect of the presence of the lactobacillus within the local microbial community could be explained by its antimicrobial characteristics, such as the ability to produce lactic acid. The main property of the lactic acid is to lower the pH of the local environment. Because of its acidic nature, it provides protection against invading pathogens. Lactic acid also prevents vertical transmission by affecting the integrity of the cervical plug. Lactobacilli also produce bacteriocins, which have the potential to inhibit bacterial growth and physically prevent other bacteria from binding to the epithelial surface. What happens in uterus? The fetus lives in the sterile environment in the fetus, and this is maintained by the cervical plug. This cervical plug provides an impermeable barrier to the bacterial ascension from the vagina. When the delivery occurs, the fetus is smeared by all over by the microbiomes. Several studies done in the university in Spain, the role of microbiome in infertility. They have found that the human microbiome project has been the importance that the microbiota has in reproductive health. Vaginal microbiota has been described as mostly dominated by lactobacillus species and lack of diminished lactobacillus presence is associated with bacterial vaginosis, dysbiosis, sexually transmitted disease, severe adverse gynecological and obstetrics outcome as genital infection, inflammation, and preterm birth. Microbiome is also related with the infertility, and this knowledge opens a new understanding for future clinical treatment. What affects the vaginal microbiota? There are certain endogenous factors like the vaginal epithelial structures as well as the microbiota change considerably from childhood to menopause. During menstruation, the non-lactobacillus species appear to increase in number, while the lactobacilli decrease or stay approximately the same number. During pregnancy, a lactobacillus dominant microbiota is strengthened by the increased estrogen level. However, at the same time, the incidence of the vulvovaginal candidiasis increases compared with the non-pregnant women. So, at the menopause, the prevalence of the lactobacilli is further decreased due to the low estrogen levels and the vaginal pH is increased. So, there is increased incidence of the urinary tract infection during menopause. Thus, estrogen has a decisive effect on the composition of the lower genital tract microbiota. The vaginal bacteria also has a pro and anti-inflammatory effects. It has been found that the D and the L lactic acid at low pH prevents production of the inflammatory mediators interleukin 6 and interleukin 8. 8. Vaginal lactic acid elicits an anti-inflammatory response from human cervicovaginal epithelium cells and inhibits production of the pro-inflammatory mediators associated with HIV acquisition. So there is activated mucosal CD4 T cells numbers are elevated in women with high risk bacteria. Because of the pro and the anti-inflammatory effect of the probiotics, it has been useful in many cases. Wherever there is environmental disruptors, as found in these days because of the use of the plastics, there is a precocious puberty and there is increased incidence of the PCOS in our young girls. These probiotics also decreases the inflammation and it improves the PCOS condition. So lactobacillus dominance and the low vaginal pH unique to the human so far. Primate vaginal microbiomes exhibit species specificity without universal lactobacillus dominance. It has been found that the apes and the monkeys have less diverse microbiota with lower percentage of the lactobacillus. Human vaginal pH is 3.5. Vaginal pH of the baboon between 6 to 8. Lactic acid and the low pH creates strong antimicrobial environment permissive of lactobacillus colonization. Lactic acid predominantly produced by the vaginal bacteria. So glycogen levels in the vaginal lumen are also variable. In monkeys, the low lactobacillus, in postmenopausal women and the prepubertal girls, low lactobacillus, and in women with bacterial vaginosis, there is a low lactobacillus. So there is increased chances of infection. Common assumption in this field is that vaginal lactobacilli use glycogen to produce lactic acid and to acidify the vagina, but lactobacilli cannot directly metabolize glycogen. Human alpha amylase present in the lower genital tract mucosal fluid processes glycogen to support vaginal colonization by lactobacilli. Many studies have been done, meta-analysis has been done for bacterial vaginosis and the infertile population. It has been found that the prevalence of the bacterial vaginosis is around 19%. Asymptomatic is up to 50% of the cases. It's linked to preterm birth, post-surgical infections, and negative impact. It has a negative impact on female fertility. Circulating hormones impact greatly upon vaginal microbiota and susceptibility of the women to infection. The exogenous hormones impact upon vaginal environment and composition of the vaginal microbiota. It has been found that the 4 months use of the GnRH agonist treatment increases the vaginal pH significantly above 4.5. In endometriosis, significant shift towards intermediate vaginal macroflora. There is a decrease in the normal vaginal flora, and in control group, similar but non-significant shifts has been found. Significantly higher colonization of the Gardnerella and the Escherichia coli in both groups of the women. An application of the antibiotic levofloxacin reduces the growth of the cultured E. coli. There is also effect on ART on vaginal microbiota. Hormones are used during IVF, and it has been found that there is significantly higher clinical pregnancy rate in the group with no microbial growth compared with the group whose cultures were positive for microbial colonization, 57% versus 29.6%, as found by IGBASE 1996. There is significantly lower clinical pregnancy rate, ongoing pregnancy rates, and implantation rate in group with positive cervical culture, 24% versus 37%, 17% versus 28%, and 9% versus 16%. While doing ovarian stimulation, when we use 16S RNA deep sequencing in IVF and ET cycle, there is shift in the vaginal microbiota in some, but not all. In all in of the women, novel bacterial strains found in 33% of the women screened during the treatment cycle. During the down regulation with GnRH analogs, the exogenous hormones impact upon the vaginal environment and the composition of the vaginal microbiota. The 4 months use of the GnRH treatment, it increases the vaginal pH significantly above 4.5. In endometriosis, the significant shift towards intermediate vaginal microflora, and it decreases in normal vaginal microflora. Vaginal microbiota on the day of the embryo transfer. It affects the pregnancy outcome. Women with ongoing pregnancy was characterized by top genera of the Lactobacillus species. The great care has to be taken to reduce the risk of the microbial transfer into the cervix during embryo transfer. Most of the time we do clinic with of the external loss with the cultural media, and we avoid touching vaginal walls and the external cervix with the catheter tip. Whenever there is infection, there is a remarkable reduction in the pregnancy rate. In tubal pregnancy, whenever there is abnormal vaginal microbiota significantly associated with tubal factor infertility. Chlamydial infection are more prevalent in the bacterial vaginosis positive women. Components of the abnormal vaginal microbiota ascend through the cervix into the upper genital tract, and pelvic inflammatory disease sets in, and it reduces the fertility. What is vaginal infection? A woman vagina makes discharge that is usually clear or slightly cloudy. In part, it is how the vagina cleans itself. It has the following signs and the symptoms like vaginal discharge: changes in color, it is heavier or smells different, can cause itching, burning, swelling, or soreness around or outside vagina. Difficulty in micturition is found. Bacterial vaginitis can spread from vagina up into the uterus and the fallopian tube. This kind of infection is called the pelvic inflammatory disease and can, if left untreated, cause damage to the tubes. This can prevent sperm from reaching the egg and cause infertility. Recurrent vaginal yeast infection cause the internal vaginal flora to become unbalanced, which may make it harder for the sperm to reach the uterus. Altered vaginal microbiota flora leads to the urogenital problems like vulvovaginal candidiasis, bacterial vaginosis, urinary tract infection, pelvic inflammatory disease. Bacterial vaginosis represents a complex change in the vaginal flora, overgrowth of the normal bacterial flora, decrease in the lactobacilli. 16% of the women may have bacterial vaginosis, many with no symptoms. Symptoms are fishy and musty odor, often after relationship, pain, itching, burning, profuse, white or the gray discharge, increase in the Gardnerella vaginalis, Mycoplasma hominis, and the anaerobic infections. Exact mechanism by which bacterial vaginosis takes place is unclear. Vulvovaginal candidiasis usually is caused by the Candida albicans, but occasionally is caused by other candida species or yeast. An estimated 75% of the women will have at least one episode of the vulvovaginal candidiasis, and 40 to 45% will have two or more episodes. And it depends on whether there is a morbidity present or not. Whether diabetic patient have a more often uh, symptoms of the vulvovaginal candidiasis. On the basis of the clinical presentation, microbiology, host factors, and the response to the therapy, vulvovaginal candidiasis can be classified as either uncomplicated or complicated. Approximately 10 to 20% of the women will have complicated vulvovaginal candidiasis, suggesting diagnostic and therapeutic consideration. Trichomonas vaginalis. Trichomonas vaginalis is caused by the protozoan Trichomonas vaginalis. Many infected women have symptoms characterized by diffuse, malodorous yellow-green vaginal discharge with vulval irritation. However, some women have minimal or no symptoms. Note the frothy discharge seems around cervix and it is diagnostic of Trichomonas vaginalis. This is the author manuscript by National Institute of the Health, and they have studied and evidence has produced in 2014 January that the studies characterize the vaginal microbiome in assisted reproductive technology, support the hypothesis that the colonizing the transfer catheter tip with Lactobacillus crispatus at the time of embryo transfer may increase the rate of implantation and live birth rate while decreasing the rate of infection. In addition, there is some evidence that a progesterone resistant endometrium might increase the risk of abnormal vaginal microbiome. Microbiota, vaginal microbiota has a great effect on preterm birth. Vaginal microbiota is important for the health of the whole reproductive tract and for prevention of the pathological infection. It can be expected that it affects not only pregnancy but also delivery. Vaginal microbiome evolves during pregnancy in relation to the gestation age and tends to lose the diversity observed in non-pregnant women. In non-lactobacillus dominant vaginal microbiota and increased bacterial diversity during pregnancy are associated with higher risk of preterm birth. It has been found in those patients with a history of the preterm birth, if lactobacillus dominant microbiomes are given, there is we can prevent premature and premature rupture of membrane. Endometrial disc biopsy can be the cause of implantation failure and leads to the infertility. A lactobacillus dominant endometrium is more receptive than an endometrium with high bacterial diversity and a low proportion of the lactobacilli. It can be expected that the hormones also influence the endometrial microbiota. Definitely, whenever there is a contamination from vaginal cervical microorganisms by the needle puncture of the vagina, there is infection, and the microorganisms that enter the endometrium from cervix during embryo transfer could damage the developing embryo and prevent pregnancy. Now we come to the treatment part. So, adding lactobacillus dominant microbiota routinely gives the better IVF outcome. IVF outcome is affected negatively. There is a lower implantation rate when there is a high abundance of the enterococci, enterobacterius cocci, and the streptococci, staphylococci, and the gram-negative bacteria is present, and there is a low abundance of the lactobacilli. There is an increased number of the miscarriage when there is a low abundance of the lactobacilli, and decreased number of the term pregnancy when there is a low abundance of the lactobacilli, and reduction of the pregnancy rate when there is a high concentration of the Gardnerella vaginalis and the Atopobium vaginale and the low abundance of the lactobacilli. Now we come to the treatment part. Treatment guidelines for the bacterial vaginosis is the guidelines are from the Centers for Disease Control and the Prevention. Recommended treatment for bacterial vaginosis is the metronidazole, 500 milligram orally twice a day for 7 days. In Indian scenario, we give 400 milligram orally twice a day for 7 days, or metronidazole 0.75% gel, one applicator 5 gram intravaginally once a day for 5 days, and clindamycin 2% cream, one applicator 5 gram intravaginally at bedtime for 7 days. Alternative treatment is clinidazole 2 gram orally once a day for 2 days, 1 gram orally once a day for 5 days, clindamycin 300 milligram orally twice a day for 7 days, and clindamycin ovules 100 milligram intravaginally at bedtime for 3 days. Studies have been done widely all over the world on cervicovaginal microbiomes, and conclusion is that the microbiome profiting enables stratification of the pregnancy chances prior to the start of the IVF or IVF-ICSI treatment. The vaginal microbiomes differ greatly between women and fluctuates between the abundance of the various bacterial species in the vaginal greatly impact the women's reproductive health and the pregnancy outcome. Studies on endometrium has been done, and the conclusion that the endometrial colonization of the persistent uh, Gardnerella vaginalis could be related to the reproductive failure, and it has been found there is an increase whenever there is a decreased lactobacilli in the endometrium, there is an increased chances of the recurrent implantation failure. Studies on fallopian tubes, and the conclusion is the electron microscopy reveals uh, observable microbial cells in the fallopian tube sample. Higher viral diversity is associated with the prophylactic antibiotic exposure in subfertile women undergoing IVF. And higher vaginal viral diversity is associated with preterm birth. Studies has been done, and it has been found that there is the abnormal vaginal microbiota may be associated with poor reproductive outcome. A prospective study is done in IVF patient. Wider implications of the findings are abnormal vaginal microbiota may negatively affect the clinical pregnancy rate in IVF patient. If a negative correlation between abnormal vaginal microbiota and a clinical pregnancy rate is corroborated, patient could be screened and subsequently treated for abnormal vaginal microbiota prior to fertility treatment. There is the relevance of assessing the uterine microbiota in infertility. And it has been found that the microbiota in the uterine cavity seems to be, most of the time, it is the continuation from the microbiota in the vagina, but several works have reported the significant differences between the vaginal and the endometrial microbiota, highlighting the relevance of the assessing the upper genital tract microbiota to better understand the potential roles of the bacteria in the physiological and the pathological process taking place in the uterine cavity, including embryo implantation, pregnancy maintenance, and other gynecological diseases. Studies has been done by the American Journal of Obs and Gynecologists, and they have found the evidence that the endometrial microbiota has an effect on the implantation success rate. The presence of the non-lactobacillus dominated microbiota in a receptive endometrium was associated with significant decrease in implantation, 60% versus 23%. Pregnancy rate 70% versus 33%. Ongoing pregnancy rate 58% versus 13.3%. And the live birth rate is 58.8% versus 6.7% rate. So the lactobacilli play a very important role for the success of the IVF cycles. Conclusion is our results demonstrate the existence of an endometrial macrobiota that is highly stable during the acquisition of the endometrial receptivity. However, pathological modification of its profile is associated with poor reproductive outcome for in vitro fertilization patients. This finding adds a novel biological dimension to the reproductive process. So, vaginal probiotics rational to develop clear hypothesis about the role of the lactobacilli, clearly established protective role of the lactobacilli. Lactobacilli are predominant in the vagina. Application can be topical, reaching high inocula or no organoleptic consideration, easy to perform clinical trials, easy sampling, easy re-isolation of the probiotics lactobacilli after application. It is available in developed countries. Now we come to the probiotics. What is the probiotics? According to the WHO, probiotics are defined as a live microorganism which, when administered in adequate amount, confers the health benefit on the host. Ideal characteristics of the probiotics are it is non-pathogenic, lactic acid producer, production of the antimicrobial substances, adherence to the gut lining, genetically stable, safety in food and the clinical use, susceptible to antibiotics, persistence in the human intestinal tract, antagonism against enteric pathogens, and acid and bile tolerant. So probiotics have a lot of properties which are useful in day-to-day life. Probiotics bacterial family is Lactobacillus, Lactococcus, and Bifidobacterium. There is a biological control of the vaginosis to improve the reproductive health. The human vaginal microbiota plays an important role in the maintenance of the women's health as well as her partners and the newborns. When this predominantly lactobacillus community is disrupted, decrease in abundance, and replaced by the different anaerobes, bacterial vaginosis may occur. In bacterial vaginosis, the overgrowth of the anaerobes produce noxious substances like polyamines and the other compound that trigger the release of the pro-inflammatory cytokines interleukins. Bacterial vaginosis can profoundly affect with different mechanisms all the phases of the woman's life in relation to reproduction, before pregnancy, during fertilization, through and at the end of the pregnancy. Bacterial vaginosis can directly affect fertility since an ascending dissemination of the involved species may lead to tubal factor infertility. Exogenous strains of the lactobacilli have been suggested as a means of re-establishing a normal healthy vaginal flora. Carefully selected probiotic strains can eliminate bacterial vaginosis and also exert an antiviral effect, thus reducing the viral load and preventing fetal and the neonatal infection. The administration of the beneficial microorganism probiotics can add recovery from infection and restore and maintain. Current opinion in the obstetrics and gynecologist 13 March 2022, 2020 and 20. They have found out that the vaginal microbiome as a tool to predict IVF success. The vaginal composition prior to the start of the hormonal treatment for ART seems to be predictive of an in vitro fertilization or in vitro fertilization intracytoplasmic sperm injections outcome with mainly a highly negative predictive value. Local microbiota, especially the absence or presence of the specific microbes within the parts of the female reproductive tract seem to be associated with outcome of ART. Now we come to the conclusion. So there is a definite relationship between the reproductive tract microbiome as cause of the infertility and outcome of the ART cycle. Presence of the bacterial vaginosis has poor pregnancy rate in ART cycle. Lactobacillus predominance in the reproductive tract has good pregnancy outcome in ART cycle. Next generation sequencing techniques for the uterine microbiome is better than the conventional culture. Thank you very much for patient hearing.
Thank you so much, ma'am, for giving the detailed information regarding how probiotic is helpful in restoring the microbiome in vaginal dysbiosis and helpful in the outcome of IVF. So we have some queries. So shall I ask you, ma'am? Huh?
Yes, sure.
So, ma'am, the one of the queries is that how much important is the bacterial strain that should be Indian genome specific in probiotics that can be helpful in vaginal dysbiosis?
Yeah, this is very helpful, and we can give the probiotics through the diets. There are many diets which contains the probiotics. Like we can add yogurt
Yes.
and soybean milk. They all are helpful. Uh, Through them, we get the probiotics, and daily vegetables, fruits. They are helpful in we are in that way we can get the probiotics, and they are very important to develop all the favorable microbiome
Microbes.
in in our body, and helpful for our normal health.
Okay, ma'am. So, ma'am,
Most of the
if
time, these days we are
yes, yes.
lacking in the probiotics because of the uh, fast food, because of the
Hmm.
environmental disruptors in environment.
Mhm. So coming to this food part, so can increased intake of dietary sugars negatively impact on this female reproductive efficiency?
Yeah, high sugar level definitely will affect the reproductive efficiency, because there is a
Hmm.
fermentation, and there is a increase in the bacterial growth, unfavorable bacterial growth.
Yeah.
It can cause the infection, and it can decrease the lactobacilli and
Hmm.
affect the normal flora.
So similarly, even the intake of high cholesterol should also be avoided.
Definitely, high cholesterol diet and
Hmm.
high this thing
Intake of
sugar can
sugars,
impact
yes.
the health of the lactobacilli, and health
Yes.
of the uh, useful flora, lactobacillus flora.
And the last question is, can endometrial microbiome can be restored by help of probiotic for conception?
Definitely, when the probiotics is absorbed through the bloodstream, they
Mhm.
definitely reach the each and every part of our system. It is
Mhm.
adherent to the gut lining. It is
Okay.
adherent to the gut lining, but it affects the
Mhm.
health of our tube, fallopian tubes,
Mhm.
ovary, and
Mhm.
endometrium and vagina and cervix.
Okay. Ma'am, thank you for giving all the answers to these questions, and we hope that participants have uh, gathered a lot of information from your webinar, ma'am. And we are glad to have you on our platform regularly, and we would like to have more sessions with you in further future, ma'am. Thank you so much,
Thank you.
ma'am.
Thank you very much for giving me the opportunity. I also
Ma'am,
learned during the process of preparing slide, and I also learned a lot. Thank you
thank
very
you.
much.
Thank